I actually loved the debate because I think everybody was not holding back. But as usual, right, I think it's good to acknowledge the wins in Hong Kong, but I think everybody is highly appreciative of actually the structural issues facing Hong Kong and how can actually be better. Because you would say Hong Kong has been in one of the greatest cities to live in, and how can we actually maintain that position? The answer has to be yes, because I don't think there's any other way for Hong Kong to continue to grow and be differentiated and be competitive if that is not implemented. I think the discussion is just how it is going to happen. I think in the discussion, everybody highlighted the structural barrier between the public and the private sector and the primary care and the hospital sector. I think those barriers needs to be removed, or at least be a lot more permeable from a patient point of view, from a payment point of view, in order for the accountable care to work. Otherwise, what we're facing with segregation of service, segregation of practices, that in the end is actually counter to the whole direction of accountable care. I think it will just be embracing the open data initiative to allow a lot of data to come out, whether it's actually on hospital charges, on costs, on productivities of hospitals, and I think more importantly, if we can, on outcomes. Because ultimately, people are actually not buying a consultation. People are not buying a hospital visit. People are making the purchases so that they can get healthy. How are we measuring ourselves? It's the ability to deliver health as a healthcare system. I think if we have that mindset and start sharing and publicizing some of these data available, both in the public and private system, I think the Hong Kong patient and consumers are smart enough, I think with the right tools, right, to actually make the right judgment for themselves.